Hello, everyone. I think I see people joining us. I'm waiting in just a couple more minutes to make sure we've got everybody hooked up. Katie, why don't you let me know if when you think everybody is joined? Hey, I'm Susan Gregg. I direct media relations for UW Medicine. Thank you for joining us today. If anybody does have a need to record, please let us know now and we will give you that permission. I know Cairo TV has asked for permission for that. If anybody else has, you can use the chat function. What we're going to do today is Dr. John Lynch, who's the Infection Control and Prevention Manager for Harborview Medical Center, will be giving you a brief update on the situation at the COVID-19 exposure at Harborview. We'll also be using the chat function after he's done the update for Q&A. And please chat everyone so we can make sure we don't duplicate questions. And we are going to finish this at 11:30 because Dr. Lynch has an engagement after that. So I appreciate everybody's timeliness with that. So without further ado, Dr. Lynch, thanks for giving an update to the media today.
Thanks, Susan, and thanks everyone for coming and joining today. I think I've met many of you in the past and talking about COVID-19 and other infectious disease issues over the years. As Susan mentioned, my name is John Lynch. I'm an infectious diseases doctor, and I'm the medical director for the Harborview Medical Center Infection Prevention and Control team. And I'm here to talk about the ongoing outbreak at Harborview Medical Center on one of our surgical floors. So this is basically an update, and I hope to provide you with more information in the future and clearly be able to answer some questions today. So as of this morning, due to this outbreak of COVID-19 on one of our units, we have 10 staff. These are Harborview staff who have tested positive and are in isolation and not working. We also unfortunately have 4 patients who have turned COVID positive during their hospitalization. And, tragically and incredibly sadly, one of those patients who contracted COVID-19 has since passed away at Harborview. We know this patient had a number of comorbidities that are commonly associated with worse outcomes in COVID-19. But unfortunately, for privacy details, I'm not able to share many more details about that specific patient. We've spent the last week and a half doing a lot of testing on our units of staff and faculty, providers, and allied healthcare workers to get a better sense of what's going on, and hence the timing of this update today. It has been very clear that this virus spreads among patients and staff because of gaps in adherence to the precautions that we know are very effective and that work both at Harborview and other medical sites across the planet. And we also recognize that Harborview's been in the midst of this since the very beginning, both in that county and in responding to the outbreak across the region. When we think about the steps taken, just briefly, when we learned about the first patient with this healthcare-associated COVID-19 infection, we also learned about the same time of employees who were positive on that same unit. This triggered a large number of activities from our infection prevention and our employee health teams, which I also am the medical director for. We decided to close the unit to new admissions, so to limit the number of new patients on the unit. We immediately tested all of the patients on the unit. That identified one additional patient. That was the 3rd patient in that workup. And then we, as a result of that 3rd patient, decided to test the entire staff who work in that unit regularly. These are, for the most part, nurses and hospital assistants, as well as some other healthcare workers. We subsequently did a 2nd round of testing on that unit of all patients and didn't identify any additional folks. So once we closed the unit to new admissions, started, obviously engaged our EVS workers in cleaning the facility and doing additional testing. We identified a number of healthcare workers who may have had exposures. because this, the seriousness with which we take these types of exposures, we decided to take a very, very conservative approach with figuring out who is exposed. So our current protocol within UW Medicine and at Harborview is that all healthcare workers must wear a mask whenever they're in the facility within 6 feet of anyone else, and that includes all patients. All healthcare workers are required also to wear eye protection whenever they are working with patients for any reason, regardless of whether the patient is wearing a mask or similar. We decided that any healthcare worker who was not wearing eye protection was potentially exposed when working with any of these patients. And as a result, we have a fairly large number of folks who we are currently quarantining. That total number is 30. And again, it's a very conservative approach. In some other sites, you wouldn't see as many people quarantined because they would have taken potentially a slightly less conservative approach. We have tested all those individuals and are tracking them throughout their period of quarantine. And we're about halfway through that period. As soon as we learned about the third patient and started doing the staff testing, we also communicated with public health on Sunday night, October 4th, and have been updating them throughout. And they've been great resources for us as we go through this. The final part I just want to quickly talk about is the source. The reason that we're concerned about this outbreak is that all three of these patients have been in the hospital for more than 14 days. That's the incubation period for COVID-19. And so we're really worried about how did the virus get into this unit. And that's really occupied much of our time over the last week after we dealt with sort of the acute response and are trying to figure out the directionality and where the virus snuck in and then kind of spread through that unit. We have done a number of things in addition to what I've talked about in terms of trying to figure that out. We've done whole genome-wide sequencing of all of the viruses. So these have been sent out to the UW Medicine Clinical Virology Lab to understand the genetic sequence of all of these to determine whether there was one or different ones. Right now, it looks like they are all very similar, but that's very commonly seen in the Seattle area. We don't see a lot of variation in this virus. So without seeing a difference, it doesn't really help us very much. But we're looking through every single hour, shift, day of overlap between patients and healthcare workers to try to provide us with some additional insight. The last thing I'll say before we open it up to questions is that, I think we've all learned, and specifically at Harborview, we've dealt with this since really February when we described the first patient death with COVID-19 and had an exposure at that point as a result of that, before we even knew about the outbreak and the community transmission, that this is a virus that preys upon any variation in behavior. We have very robust personal protective equipment that keep healthcare workers safe and to keep patients safe. But when we vary from that in any way, shape, or form in the community or at work, this virus takes advantage of it. And most of the time, I think we can get away with it in the community, in work, and similar. But sometimes we can't. And whenever those slip-ups happen, this virus can slip in and cause this type of problem. And so, it's just a significant, challenge for all of us in the community to think about where we are 9 months into this in our area and the COVID fatigue that a lot of people are talking about. This is true for healthcare workers as much, if not more, than it is for other members of the community. And so, again, as we work through this and trying to figure out exactly how things entered in, the most important thing is our response. And again, supporting healthcare workers and making sure that patients are feeling safe and cared for, and they're able to do the very important work that Harborview is here for. We have to keep Harborview's doors open. We have to keep it as safe as possible. And I currently feel that is true. We should continue to be doing our work. Patients should feel very safe in our facility, as should healthcare workers. So with that, I'll stop and see if there's questions.
Thank you, John. We'll open it up for questions via chat, and everybody is on mute, so please send your questions via chat, and please tell us where you're from as well. Okay, this is from Eric Wilkinson. Can you give us a specific timeline of the outbreak, when it was first detected, and when was your first action? When was the death? Yeah, so this outbreak was detected as an outbreak right around the turn of the month. So between September 29th and October 2nd was when we really started to see the cluster of patient infections and healthcare worker infections.
It was really starting on October 1st that we started taking actions with the surveillance of the entire patient population. That occurred on that Saturday evening. And that's when we closed the unit to new admissions and started working with the staff and the healthcare workers. The exact date of the death was, I don't actually know off the top of my head. The patient was transferred to the ICU and I believe died towards the end of the last week. Susan, you may have the exact date of the patient. To be clear, I was not involved in the clinical care of that patient.
I will follow up with you, Eric, to provide you that date. I do not have it right now.
Susan, you want me to read the quote or the question, or do you want to read it?
I can. Ryan Sims from Cairo 7. What kind of impact is there on medical care with so many employees and doctors in quarantine?
That's a great question. So many of these employees are, they're obviously, the biggest impact is on this single unit. It is a surgical unit where patients who are going to surgery, returning from surgery, patients who are involved in traumas are taken care of. So it's a really important unit, as are all of our units. And this is a large number of people being off. So right now the hospitals is just working on coordinating and making sure that that unit is supported. Obviously, as we close the unit to new admissions, the census on that unit decreased, so we're able to continue staffing. And I think it is honestly an ongoing challenge. But I want to assure everyone on this call and the community that we are never below our appropriate staffing levels and appropriate safe staffing levels. But as of right now, it's a lot of work for everyone, but right now we are accommodating it.
All righty, thank you. And the next question is from Gina Cole and Evan Bush from the Seattle Times. We'd also want to know that date. Oh, sorry, I should have read that before. I will get the dates to everybody. I'll put the dates when we send out the recording from this. Como Radio, we've got Sue Romero asking, would also like to know the date. Sorry, I'm not reading very carefully today, everybody. Do we have any other questions? I'm not seeing any other that have come in at this point.
Please describe the PPE protocols for staff and intake for surgical patients. So at Harborview Medical Center, like all UW Medicine hospitals, many months ago, we decided to do admission testing for all patients coming into the hospital. So every patient gets a COVID-19 test. This is a PCR. It's the most sensitive test we have out there. And for patients who are undergoing what are called aerosol generating procedures, which include surgeries and similar, we do repeat testing for them prior to their procedure, generally within 3 days. And in fact, that was the way one of these patients was detected, was through that surveillance testing. It wasn't through symptoms, it was through pre-procedural evaluation. And so in some ways, I could point to our policies around testing as one of the things that captured this very early. In terms of PPE, as I mentioned, all of our healthcare workers are using surgical masks and eye protection in all patient interactions. We have plenty of surgical masks, and we encourage our employees to get rid of their masks, trade them off, not wait till they're dirty, wet, or torn, and to use them quite freely and regularly throughout all patient encounters. We recognize that I think masking is pretty well ingrained in healthcare worker and in much of our community. Eye protection is an area that's still a challenge for a lot of people. As we work with healthcare workers, the muscle memory of taking that eye protection, like goggles or face shield, off the top of their head and putting it behind their glasses, in front of their glasses, over their eyes, or over their face with the case of a face shield is still an area of opportunity. And we're working with the teams to try to improve that. It's just something that's new and different, and it's remains a challenge for healthcare workers. But that is our expectation for all individuals.
And now we have from Nick from Como, is it likely that a staff member brought this in?
Yeah, so there's a few possibilities here, right? So one is, did a healthcare worker who is pre-symptomatic or symptomatic come to work? Did a visitor come in with COVID-19 and introduce this? Or did a patient who had COVID-19 somehow interact with another patient? While those are all possibilities, we don't think that there was another patient who was undetected who had COVID-19 to interact with these patients. As of right now, the first and third patient had visitors. We have not tested all those visitors, but we have tested some of them, and so far we've not detected any infections in those visitors. And we do know that healthcare workers are positive, and were positive around the time that the patient subsequently became positive. So we're basically functioning on the assumption that this was linked to healthcare worker activity. It is going to be very hard to prove that, because even genetic sequencing won't tell us exactly what's going on. But when we look at it, really our investigation right now is focused on potential gaps in adherence to our standardized and accepted PPE and around working with patients.
Thank you, John. Pablo from Univision, what kind of medical procedures happen in the area of the hospital where the outbreak was detected?
So this is a regular, what we call kind of an acute care floor that is focused on surgical patients. As you know, Harborview is a level 1 trauma center. We have a very large population of patients who have suffered with trauma. And if they don't require intensive care, this would be a unit where they would go. So in terms of procedures, it would be mostly limited to things like dressing changes, wound care, and similar. There are patients who require obviously oxygen supplementation and similar, but we don't do things like bronchoscopy. This is where you put a tube down someone's throat, or look down someone's throat to look in there, or other invasive procedures. It's not an ICU where urgent surgical procedures are done or similar. These are patients who are generally medically stable and are either going to the operating room or coming back from the operating room or continuing their care on a general surgery team.
And I missed one with Eric from Eric Wilkinson. Have there been any other COVID cases detected in staff at Harborview?
We have definitely had staff, just like every other hospital and workplace in Seattle. We've had staff who have been positive. When we look at those staff, there are usually, most often, risk factors in the community, either exposures in the community, known COVID exposures, or known exposure in situations that are at high risk. Eating in a restaurant, being in a group gym situation, going on a vacation trip with a large number of other people, having people over their house, or unmasked, undistanced, and similar, or frank COVID-19 exposures, living with someone who has COVID-19. And so that's been really the majority of the situation. In this particular situation, we think that certainly played a role in what's going on with the healthcare workers and most likely the patients. But I want to emphasize again that healthcare workers are just like everyone else. They are exhausted by all of this, the amount of work that they do, the intensity of the work they're doing amidst this pandemic, the PPE that they're required to wear is very challenging. And, like all of us, being isolated in the community, being separated from the normal relationships and activities are tough. They're tough on them. And I want to be clear that I'm not blaming anyone. This is really a problem of the larger pandemic and the impact it's having on people.
So Evan Bush from the Times, John, do you believe the virus was transmitted through eye exposure? And then Evan, we can just tell you that it's a surgical unit at Harborview. We want to be sensitive to the privacy of our patients and not name the specific unit. So can you?
But I will answer the eye exposure. So that's a really good question, Evan. If you follow this, the scientific literature around this, there are some data indicating that the eye is a risk for transmission. And particularly if there's, for instance, if someone is acutely infected and there's a lot of virus, I think it's a real concern for us. And that's why we require eye protection in all of these settings. We really want to maximize safety. There are scientific papers that support that transmission can occur through the mucosal surface of the eye, the conjunctiva, that pink part. It doesn't seem to be a major mechanism, but you have to remember healthcare workers are often very close to patients, and patients are, often because of, their recovery and the status that they're in, may need to be fed, may need to be suctioned, they may need to have wound care on their face. There may be coughing that's very close. And so that's why we've taken this very, very conservative approach in our quarantine. If you were in those rooms with a patient and you were on eye protection, we count that as concerning enough that we quarantine those individuals. And I'm not saying that, comparing us to anyone else, but in many other situations that may not be the case. It's just the conservative approach we've decided to take.
So Eric, from King, how confident are you that you have stopped the spread? Have any of those who now tested positive been hospitalized?
As far as I know, we have not had to hospitalize any of the people who have tested. So any of the healthcare workers. The ones who are positive are all recovering at home. In terms of I think the other part was, do I have it contained? Susan, was that the question?
Yeah, are we confident that it's contained in the unit? Has it spread?
So I will point out this is an ongoing investigation. And I think we're going to need some more time to be sure whether it's contained or not. We do have a fourth person who is positive on the unit who had no connection so far with any of the known infected healthcare workers, although we're trying to figure out whether some of them who don't document may have worked with this one patient. And so that investigation is ongoing. Again, all of these patients, we're keeping the unit closed to new admissions. We're obviously doing the cleaning. We're doing another round of surveillance today of all patients on the unit and of all healthcare workers on that unit in order to make sure that we're doing everything possible to control that.
And Evan had another one about how many COVID-19 HIIs, you're talking healthcare associated infections, I believe, has Harborview had since the pandemic began?
Very, very few. I mean, this is really our first experience. I think we may have had one or two others. I'd have to get back to you, Evan, on the exact number, but this has not been a problem for us. And so I'm pretty sure, Susan, keep me honest here, but I think this is really our first outbreak of this sort.
That's what I was thinking. That was my understanding.
Yeah, and so again, I can confirm with you in terms of like the number of episodes, but it's very, 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 very few, and very, very, very limited if they've occurred. And so this is really our first go around, and certainly the first time I've needed to update public health or the public about this situation. And I just want to recognize that our this is at Harborview. We had one of the first patients with COVID-19 in the ICU back in February. We had a death and an exposure before we even knew about COVID-19. So we've definitely had exposures, and just like everyone else in healthcare. And we've worked through all those, and the mechanisms and tools and protocols and people we've had in place have kept people safe. But this thing it just preys upon any gap. And that gap can occur over and over, but then it just waits there for that opportunity and jumps in. I'd also just want to recognize that Harborview is very challenged by our architecture. We have a lot of shared spaces and a lot of very sick people in our facility. And so there's a lot of double rooms, there's some triple rooms, there's some wards, and we do our very, very, very best to keep patients safe in all of those scenarios. But we are to some extent limited by that architecture.
Now, Ryan Sims from Cairo, at what point would Harborview need to start relying on other hospitals for support with so many medical professionals out?
Well, so we work throughout UW Medicine. We have continuously worked throughout UW Medicine. I'll just remind everyone that UW Medicine includes Valley Medical Center, UW-MC, Montlake, and Northwest campuses. So we actually have, a lot of capability within our system itself. We have not needed to transfer patients from this unit to any other place or directly as a result of this particular outbreak, move patients to other facilities. If we were to need to do that, we would work with our other UW Medicine partners as we do on a daily basis in our response to this outbreak. When we actually, as we've done this work throughout the pandemic, we've recognized that we need to be able to move patients safely, without COVID, as well as with COVID, in order to keep things safe. So that would be nothing new or different. It would be part of our normal operations.
And then Evan from the Times, tell us more about the decision not to disclose this publicly for the last couple of weeks.
So we spent the first week getting a handle on what was going on. So it was a lot of testing. Our infection prevention employee health teams were working around the clock to understand what was actually happening. And it took us basically that first week and a half to get all the tests back, get all the data done, figure it all out. And we've really spent this week trying to figure out what was the underlying problem here, what was the gap what was the opportunity, what was the directionality. We had to send off the genetic sequences, the viral samples to get sequenced, which we got back, I think, on Monday or Tuesday. And so comparing and contrasting those sequences are really put us to where we are right now, where I think we have a better understanding of what's happening. Well, it's imperfect, but given all that, I think this was really the decision to, once we could actually coherently speak about it, was the decision to share with the community. We have been sharing this with all of our managers on a daily basis. So we have not, we've been very public about this within the Harborview community. Again, we tested well over 100 people on our unit. And again, we've shared it at our daily safety huddles, which occur every single day at 10 a.m. with all managers who are welcome, are invited actually and asked to share information with their frontline folks. So we have been actively communicating with our teams at Harborview. And again, working very hard over the last 9 days or so, 10 days, to understand what's actually happening in order to share it.
John, since I know you've got to wrap up in a few minutes, can you just finish with moving forward what we're doing with our visitor policy and other, mitigation?
Yes. So, in terms of what we're doing, I mean, there's a lot, right? So we continue to work very hard. We're doing another round of surveillance testing on healthcare workers and patients today, tomorrow, and the next day. It's a 24-hour facility, so getting everyone in to get tested is pretty challenging, but we're doing that. We are restricting our visitors a bit more. This is probably bringing us more in line with many other facilities at Harborview. This is a challenge because part of patients' healing is having visitors and having family and loved ones participate in their care, so to speak. And but unfortunately, that's a gap for us. We have visitors come in. They sometimes have symptoms. There's often variation in mask wearing, and often these visitors are visiting patients where there's another patient. And so we really want to reduce that risk as much as possible. So above and beyond our screening at the front doors and asking questions around symptoms and exposures and positive tests, we are limiting hours. I believe the new hours at Harborview are 2 to 6, Susan. So that's one thing. We are restricting movement of patients within the facility. Harborview, has dedication to a wide variety of medical problems and issues. And many of our patients in our mission populations have gotten used to in our facility a bit of freedom in movement. And we're going to ask them to not do that anymore. So we're going to really ask our patients to stay in their rooms and on their units. That means they can't go outside to, for instance, smoke cigarettes or similar. They're not going to be able to go to the cafeteria. And again, this is very consistent with what 99% of the local hospitals do already. And we're just bringing our culture into alignment with that to minimize the risk there. We are also working very hard, and we actually started this last Wednesday. We're going to continue to do it with both messaging and auditing of healthcare workers to help support them, particularly on the eyewear part. I think everyone's really, really good about the masking. When I walk around all the units, we see very, very, very good adherence to masking, but potentially gaps and opportunities around the eye protection. So we're going to be working very hard on helping to remind our healthcare workers about that. We have throughout this entire time, and I just want to be very, very clear, we have messaged from day one that healthcare workers with any symptoms at all are to stay home and to get tested. And we make testing easily and freely available to all healthcare workers. It's a drive-through right at Harborview, 7 days a week. They just have a survey, they fill it online, and we really, really want them to stay home and to get tested. And again, that's free to them, and we try to make it very, very, very straightforward for them to schedule. I think those are the broad parts of this in terms of our actions. Our radars are extremely, high right now, and keeping an eye open for all this stuff. We are going to continue our admission surveillance. We're going to continue our pre-procedure surveillance. We're going to continue working with our provider teams to keep an eye out for patients who develop signs and symptoms of COVID-19 in the units. But ultimately, we can do all that work, but until we get community levels under better control, all healthcare facilities, all healthcare workers are going to be at increased risk. You've probably all seen the data from King County Public Health, Public Health Seattle King County, and where we are in terms of our rate, approaching 100 cases per 100,000 over the last 14 days. That is an unacceptably high rate, and it puts both our community and our hospitals at very high risk for just this type of outbreak. We're going to do everything we possibly can to prevent it ever happening again. But, you know, it is going to be something that preys upon any variation of behavior. And that's part of human nature.
Thank you, John. We're going to close. So if people have questions, I will get the recording out and I will get out the date of the death. If you have any other follow-up, please email me and I will try and get you that information as soon as I can. So thank you, John. Thank you, everybody, for joining. And we're going to say goodbye. Thank you, everybody.
Thank you, everyone.